So I feel like Michael Phelps made cupping popular when he was in the Olympics because everyone was able to see the big red circles on his arm. Cupping is great for recovery because it does bring so much blood flow to the area. I find I use it more for facilitating movement. So I'm going to show you here how I like to use cupping for the IT band, but it's nice to use in any time you need to cover a large amount of area where there is a lot of tightness, whether that is fascial or muscular. But I'm going to show you on the IT band. So there's a couple different ways you can do cupping. One of which is just if you find there's just one spot that's particularly restricted, you know, sometimes the IT band, it starts to just kind of bind down onto the quad and make it hard to get into flexion or make it hard for your hip mobility. So you can just do a static cupping where you find that one spot, you put the cup on, and you can just leave it there for like 15 minutes and wait for all that blood flow to come to the area. This is the one that's going to provide that bruise that's going to last, 2 to 3 days. My preference though is, especially for the IT band, is a dynamic style of cupping, so I can then move this up and down the IT band to try to find where is it actually the most restricted, and you'll be able to tell because it'll start to become really difficult to move. And then you can wait a little bit until you kind of gain some of that blood flow. The blood flow is going to enhance the pliability of the tissue, just like stretching might. And I can scan that whole IT band and just lift it off of the quad. It's not the most comfortable thing, but luckily with the suction you can kind of increase or decrease it to a person's tolerance. And then that's working actually really nicely here on her IT band. And then the third, you can then use multiple cups and you can add dynamic movement, or the patient can add dynamic movement. She can do things off the table. She can do things with a mobilization belt. I'll just show you here. I'm going to add just a nice stretch to her IT band. With the cups on, you can keep that leg straight, and we're just going to move it through range. And the lifting of that fascia is going to help the muscles to glide and get a better stretch. And these are all just options.